Hello, my name is Clara Maveglia and I set up the Cultural Entrepreneurship Institute. Today, Mark Hallett is my guest. We are in Berlin at the International Congress of Clinical Neurophysiology. Welcome, Mr. Hallett. Hello, Professor Hallett. I'm very glad and delighted that you are here talking with us today about your work. And we are here at the Congress for Neurophysiology. And you are working at the National Institute of Health in the US. And I would like you to introduce yourself, please.
Okay. Well, my name is Mark Hallett, as you noted. I have been working at the National Institutes of Health for 30 years now. My own research is in a group called the Human Motor Control Section. As you know, the National Institutes of Health is a large government research institution. It isn't a university formally. So our main activity is research, and my group is called the Human Motor Control Section. Our mission is to understand the basic principles of human movement. How do people make movements? How do people learn movements? How they develop skills and things of this sort. And we use that information to learn about human movement disorders, which is a subspecialty of neurology. So problems such as Parkinson's disease, essential tremor, dystonia, myoclonus, those types of disorders are ones that we try to understand. And in doing so, we use many of the techniques of clinical neurophysiology. Movement disorders is actually a relatively new field, and clinical neurophysiology is an older field, an older subspecialty of neurology, which is a field that gives us a physiological way of measuring the brain and muscle function that allows a better insight into what's going on with a particular patient, particularly when they're moving. So I was first trained as a neurologist and then clinical neurophysiologist, and then I got interested in movement disorders, and I can apply the tools of clinical neurophysiology to help us understand the patients with movement disorders much better. So we do a lot of different clinical neurophysiological tests in our patients, trying to understand how these movement disorders come about, and hope that as we improve the understanding, that this will help us with the treatment of those patients.
Okay, can you tell us about these new modalities, new non-invasive techniques in neurophysiology?
Yes, there are a large number of non-invasive techniques for looking at the brain. Of course, the oldest is probably just EEG, electroencephalography. And that still remains a very useful test. This is the way that we look at brain waves. Now, you can also look at the magnetic field as well as the electric field, and that's called magnetoencephalography. So we can do that as well as electroencephalography. And I think the advance in that area has been in the ability to deal with what's now popularly called big data. There are multiple channels of information that we collect with EEG and MEG, and it has been very difficult to understand all of that information. It's been massive. And with new mathematical techniques, we're able to analyze this information and come up with new insights into how the brain is working. So that's one technique. Another technique, which is very popular at the moment, is neuroimaging. And there are a number of neuroimaging techniques as well. Perhaps the most popular is magnetic resonance imaging, or MRI. And when one is looking at the function of the brain, you call that functional MRI or fMRI. And with that, one can see the different parts of the brain as they're engaged in different functions, and that also gives us a lot of insight into what's happening. The third non-invasive method that has become, again, very popular, and this is probably the order of 2 decades now, is the use of various techniques to stimulate the brain through the scalp. The first method that really became popular in this regard is transcranial magnetic stimulation, where we can give a single pulse of magnetic energy to go into the brain to cause a brief excitation or inhibition of the neurons in the brain underneath where we are stimulating. And that can be used to study the physiology of the brain, and people have also begun to use it for therapy. Now, TMS turns out to be very versatile. One can give trains of stimulation in a wide variety of ways that can, again, look at physiology and treatment in different styles. And then there are other techniques using electrical stimulation as well as magnetic stimulation. And these techniques seem to be pretty simple, where one can just use sort of a battery-driven device to give relatively low currents into the brain, but that also has a profound effect. And again, one can use that for physiological understanding and also for treatment. So there have been a number of treatment trials with these types of techniques. So the non-invasive brain stimulation methods are different from the other ones in that we can use them for treatment as well as understanding.
Yeah, very, very interesting. And now that you have talked about this wide range, you were talking yesterday here at the Congress on the free will, talking about the will of to move in this case. And you were talking or explaining again the Libet experiment. So it's something very well known in Germany. And you were saying also that you were repeating this experiment with TMS method, and you even saw that the performance was even earlier or better. Can you explain this? Or 8 seconds was before the movement. This,
right.
I think, could be because the Libet experiment is very popular also among philosophers in our community. So if you could talk about this confirmation of the Libet experiment and even more, would be nice, would be good.
Okay, sure. I'd be happy to talk about that. So I have been interested in the issue of voluntary movement for a long time. As I mentioned, the main purpose of our group is to understand movement. We're the human motor control section, and we want to understand movement. And the ability to understand voluntary movement is quite important. That's a major movement class, which is what people do a lot of the time. And the question is, how do we understand the nature of voluntariness as it applies to movement? And I think that my interest was also stimulated in this regard by a number of patients that we see who have problems with voluntary movements. So we see patients, for example, which we call functional movement disorders or psychogenic movement disorders, where the movements look voluntary, but the patients say they're involuntary. And so we want to, and there are a number of other neurological conditions as well, where issues of voluntariness come up as important neurological problems. So as we began to think about that, we began to think about, well, what makes a movement voluntary? What is the essence of voluntariness? And of course, it's a very interesting problem on its own, but it has significant implications for the understanding of our patients as well. So for these reasons, we began to go back and look at the issues of volition in some detail. And we have repeated the Libet experiment, the famous Libet experiment. And perhaps just to note that for people who might not know about that experiment, Libet and his colleagues combined for the first time two known techniques. One technique for looking at brain activity using a EEG method in which you can look at what's called the Brightschaft potential, a EEG negativity in the brain that is present for about a second or a second and a half before movement. Libet wanted to ask the question, when do people have the sense of willing that movement? And he wanted to compare that to the timing of the Brightschaft potential. Now, he used a method for timing of subjective events that had been introduced in the literature before, but he was the first to apply it for this particular issue. And he was able to ask people to define when they had the intention to move. And they did this by looking at a clock on the wall, and when they had the intention, they basically remembered what time the hand was on the clock, and they could compare that time, which he called the W time, that's the time of willing, to the timing of the Brightschaft potential. And the sort of famous result is that the W time is only a few hundred milliseconds before movement onset, where the Brightschaft potential is about a second before movement onset. So it looks like the brain is beginning to prepare the movement far in advance of a person's recognition of the willing of that event. Now, the 8-second thing that you were talking about in your question relates to doing the same experiment with MRI. That was not our work, but it was work that I was mentioning in my lecture, where it's possible to do that same experiment rather than with EEG, to do it with fMRI. And in that experiment, the investigators asked people to freely choose to move their right hand or their left hand, and they could do it whenever they wanted. Again, there was a way of marking the time of that event, and they compared that to the brain activity as seen by the MRI. And what they identified was that they could see in the MRI signal information as early as 8 seconds before the movement, indicating whether the people would move their right hand or the left hand. Now, it was only with 60% accuracy at that point. It wasn't as if they could predict it 100%, but it was greater than chance, and it indicated that there was information pretty long in advance of a movement as to when it might be occurring. So it does indicate that, I think, that the brain is involved in a lot of unconscious things almost all the time. It's working, probably in a sense thinking about many different things at the same time, including the possibilities of making movements in the future. And if one looks very cleverly with MRI or EEG, you can see that happening. And then it's only close to the event itself where it bubbles up into consciousness and people become aware that it's going to be happening. So that's the essence of what I think is going on in this regard.
Oh, this is really fascinating, and having explained that by an expert like you. So now, going back to your position, you're working in a National Institute of Health in the US, so this means a real large, important institution. For people aiming to work there too, it would be interesting to know how does this work is? How do you manage this? What is your daily work, for example? What are you doing? Exactly. One day of your work.
One day of life?
Yes, practical. Yes, yeah.
One day of life. So basically, as I mentioned earlier, the National Institutes of Health is a research institution. So my group, as other groups, devote their time mostly to doing neurological and neuroscience research. There's another aspect of what we do, and that is much of the work that we do is on patients. Because we want to understand movement disorders, and we also study normal individuals because we're looking at normal movement. The neurologists that are working with us are coming to be trained in how to do academic research, but they also are being trained simultaneously in the clinical management of these patients. So a certain amount of our time is devoted to seeing patients, to make diagnosis and treatment recommendations for them, so that we can do the training, the clinical training that is appropriate for those neurologists, as well as identifying patients that are suitable for our research work, which, as I say, is the majority of our time. Now, you asked me earlier about the different non-invasive tools that are possible to be used, and I'm fortunate at the NIH that we have the capability of using all of those tools to analyze non-invasively the physiology of normal movement and patients' movements. So we have a number of people working on with each of those different methods. Now, my own day at this point in my career is spent mostly supervising all the fellows. They have the good time. They have the opportunity to do a lot of the work, and my job is to make sure they're doing the right thing. I help them plan the experiments. I go over the experiments with them. I have to spend a lot of time writing and going to meetings, and they have the fun of doing the experiments themselves. Occasionally I get into the laboratory, which I always enjoy, but I don't have much time for that in my own activities now. Of course, when I first went, I did, but as time went on, the number of administrative responsibilities grew, and I have less and less time for that now. Now, in terms of people wanting to come, you had asked about that specifically. The National Institutes of Health has a very large number of trainees. I must say that my sense is that the NIH really, even though we are a research institution, it's a very high mission of the NIH to do training as well. So we have many, many trainees at all levels of training, mostly postdoctoral people, but there are people who are predoctoral also that are there. And we have many people from all over the world who come to NIH. People come from almost all countries of the world to participate in NIH. It probably is the largest single medical research institute in the world. It has a lot of good facilities, and people come from everywhere to spend some time there. So, and there are many different ways of getting there. There are many different granting mechanisms. Many people from countries outside the United States have to bring their own fellowships, but we have fellowships from NIH also that can sometimes help people come. So the NIH is really a international organization, even though it's in the United States and sponsored by the United States government.
This is really interesting. And since you are working and you're an expert in this field or in the researching, in the most of the countries, or the first thing they cut usually is the funding for research. So I would like to ask you, why is research so important?
Research is very important for a number of reasons. First of all, we advance knowledge, and specifically at the NIH, we're advancing knowledge for the purposes of health, so that the idea of improving people's well-being is certainly a very good goal in that regard. But the other aspect of research is that it actually runs a dynamic engine of economics. It's been very well demonstrated that if you have good new research advances, that it stimulates the economy and can make things grow and develop new things. So investment in medical research is advantageous not only for well-being but also for economic growth. So I've always thought it a sort of foolish to cut back on research that sort of kills your, sort of like suicide.
From tomorrow on, you will be the president of the International Federation of Clinical Neurophysiology. What are your plans during this presidency?
My plans as president are to continue to promote the goals of the organization. The International Federation has been mainly involved with education and the upgrading of the quality of clinical neurophysiology around the world. We want to make sure that people who are practicing clinical neurophysiology know the right techniques, are using them appropriately, and bringing them to the advantage of our patients. And I think that is really the major goal. In a lot of the developed countries, the techniques are already in pretty good use, and that's where a lot of the research is going on to make them better. In a number of countries, largely developing countries, is where we have to go in and provide some basic education so that we can make sure that these methods do become available to the patients in an appropriate way. We do this by educational courses, by regional meetings, and by our flagship journal, Clinical Neurophysiology, where we're able to publish new scientific articles and to also provide education in terms of reviews in these different fields.
Thank you for all these inspiring insights. Now we have the last question, is very popular in our community, is as a neuroscientist you are closer to the mystery of life. So what does really matter in life?
I think that one can deal with that on a sort of personal level, and I think that in general each person is here for a relatively short time. I heard a phrase recently that we are all fellow passengers to death. So we're here a short time, and I think that it is valuable to do things that, each person should do things that they enjoy doing. That this is an important thing. People should enjoy what they are doing. And of course it's advantageous if what they enjoy doing is a useful thing for other people as well. And I think that my sense is that there's a important social drive that people have, that if you are good and friendly and cooperative and helpful to other people, then you will get that in a reciprocal fashion. And I think that if one makes that a part of one's life activities, that it increases the ability to enjoy oneself. So I think that that's the sort of secret to life, as you will.
Thank you very much. So I wish you very much joy in the next years.
Right. Thank you very much indeed.
Thank you.